Hello, everybody.
What's up, everyone?
Another week, another dollar. I'm Sheila.
Not even $1. And I'm Roel.
Welcome to the
CommoNurse
CommoNurse
podcast.
All right, gonna be an interesting
Like how I
week.
wish we can have $1 for every episode.
Right? Like,
it's not even that.
well, you guys, please like, share, and subscribe if you're interested
We're
in our
begging
topics.
you.
But yeah, we're just we love doing this. That's why we keep on doing it. But if you also love our episodes or our topic and our contents, please comment down below and also make sure to share this to your friends. Thank you very much. Yeah. It's a beautiful week. It's 8th of May, and on a Monday, it's a beautiful start of the week because this is the International Nurses Week. All right, we are in celebration of International Nurses Week, and we celebrate the superheroes or the superhumans that doesn't wear capes. They just wear scrubs. Am I right?
And caps and masks.
And caps and masks. That's
everything
right.
that comes along with it.
And all the PPE gowned up, and all you can see is their smile behind that mask and through their eyes. Do you agree?
Yeah. No,
Hindi ka man convinced.
I'm definitely convinced that.
All right, so it's gonna be
heroes.
It's gonna be a nursing topic this week. So I'm very, very happy, and I'm very much interested to share this with you guys, like our thoughts basically on what nursing is to us, and
like the good side of it.
True. And despite all the struggles and the challenges that I think we've already discussed and tackled in this podcast, I think more than ever, we also want to put a bit of light and a positive note on what nursing is.
Hopefully.
Actually. Yeah, hopefully from our perspective. But yeah, if you want to add more context into that, please feel free. All right, so I'm going to jump into it.
No, it's a very cold start to the week, though.
It is.
Yeah, my brain is lagging. Well, it always has been lagging, but it's just a bit extra. There's a bit extra of delay.
True. I know you're very much interested to discuss a different topic, but I really sure hope that we should just have a conversation about what nursing is, basically. So yeah, first up. What do you love about nursing?
Hot seat.
Yeah, tough question, hey.
Well, I think I previously shared this in our previous episode. Like, it was never my first choice, but then I've learned in a way to love it because it's somewhat like, what's the term? Like, it's giving you satisfaction whenever someone gives you a small token of appreciation. Okay. It doesn't even have to be like, yes, we're going to say something, Wata.
Please welcome Wata, guys.
Sorry,
I forgot to introduce. Before we go back, so I'll give you more time to think. Guys, I think you've watched our my recent vlog, and I'm here to introduce to you our Kento here. Our third chunky, he's sleeping. Oh, he's sleeping.
He's right there.
He's right here. And he's our 8-week-old Frenchie. And also like from where we got Wata as well, like the owners. So we had him over the weekend and he was like beautiful. Are you happy?
Yeah, definitely. Super.
So this is Ruel's birthday gift. Yearly gift, is it?
No. That's
no.
3 is enough.
Yeah, I think so. I think 3 is the
perfect
number
for us.
For us. I was aiming for 5, but I don't think it's going to be ideal.
So I did read through like the laws about owning a dog and that we're not breeders.
Yep.
We're
only allowed to have.
Yeah, in Queensland.
Yep.
Or in ACT. Or anywhere.
We're only allowed
maximum
to have
4.
4.
But then there's a catch to that. Your house has to be like a separate, a fully detached house.
Yeah.
So I don't know how we're gonna work this out, living in a townhouse, but we'll figure it out.
Yeah, we always do. Like we always do. Anyway,
And going back to the question. So, what was it again?
Why? What do you love about nursing?
So as I mentioned earlier, so that's it. Like it gives you the satisfaction whenever someone gives you an appreciation.
Yep.
Even the smallest bit of thank you would mean a lot. Like that's something I did not expect when I entered nursing, because since it wasn't my choice, it was like a profession that I was, what's the term?
What, a profession that you're not. It's not your passion.
Initially, it wasn't. But then you as you gained experiences to your various workplaces, you get to learn to love it.
Yeah, true. From my end, I think what I love about nursing is that it's a really fulfilling career. It's not like you really have to be really productive. It's just that
you don't really have to be productive.
You do, but in a way, because every action that we do, like especially in ED, what gives me that, you said, satisfaction is that I know that I'm saving a life. Like I'm making a difference in someone else's life, especially in their most vulnerable and very weakest point, like the lowest point of their life. Like I get to see patients that are very vulnerable. They just don't care when they're naked, but you're this person who actually looks after them and always try to put them first and always give them privacy, as like giving them that dignity that they needed, especially during those times that they're just, I'm sick, I'm here, cure me, this is it, I'm leaving it up to you. So those kind of moments, like they're tiny bits, like what you said, but even the smallest thank yous as well, like it will just make your heart melt. Like you don't even think of a lot of things, but just you doing your job, but then you're making people's lives better.
Yeah, definitely.
Yeah. All right. So
also, I would just like to expound on that a little bit, because I'm quite a science guy. So I think nursing gave me the opportunity to explore that a little bit, like the human body in general.
Yeah, very interesting, isn't it?
Of all my nursing subjects, back in uni or college, the one that really interests me the most is anatomy and
physiology.
Yeah.
Exactly.
Yeah.
Not the pathophysiology, but the anatomy and physiology.
That was probably the subject that like opened my eyes to.
Yeah, and it's like my teacher back then, she was so interesting, and she made it like really interactive for us.
Yeah.
And it was a beautiful subject that I really learned a lot.
Yeah, even up to now, like I can still make use of like
the human bones.
Yeah. As to what their names are, or what's the proper description for a particular thing. Like
yeah, those little things.
That subject that really made me somewhat fall in love, like learning more about nursing.
True, and as what you said, I think also it also reflected on the previous interviews that we had with our fellow nurses, like our friends that we invited to the podcast, is that not all of us, nursing is our first choice. Nursing is actually the one that we fell in love with because of the things that we're doing during the time that we're studying, and now that we're practicing, you're really dived into what nursing is all about, and you're discovering more of yourself, isn't it, as a whole?
Yeah.
Alrighty, so and in saying that, next question would be, what actually catapulted? Oh, my term ako doon. Catapulted your, like, what changed your mind and how you would see nursing as a career, as a like a now professionally, and as like a long-term livelihood. So what flipped it? What flipped it? Because I know at first we were like, oh, I don't like nursing. Like, it's like not in my alley. This is not sports. This is not something that I'm interested with. This is not really like, it's kind of boring. But
no, I wouldn't call it boring. But again,
yeah.
it's as what I've mentioned earlier. It's it's the science of it.
Yeah.
Like the fact that you continuously discover little things like about the human body. That's what keeps me going, really.
For me, I think the highlight of it all is when I gained so much experience that I gained so much confidence in
Yeah.
myself, and I'm practicing what I like and I'm confident in what I'm doing. I think that's how nursing is to me now. Like before, because I was always that person that's scared. That I'm scared because
There's always
nursing
that thing that at the back of your head that you don't know enough.
exactly, and that's like, let's face it, nursing is a really big
Yeah.
responsibility. Everything in healthcare is a big responsibility. That's patients or
It's so
people's
big that
life.
there's specializations around it. Like you
Exactly.
can't know it all.
Yeah, true. True. And then touching base in that, what is your favorite area of nursing? Like, I would say mine at the moment, I'm really enjoying ED.
Well, I've
As
been there.
much as
I've
much
been
as I've
there, and
I've
I
been
miss it.
yeah.
Just because of the fact that you like when you try to resuscitate someone
Yeah,
and then
yeah.
you bring them back literally to life.
Yeah, yeah.
That is a very rewarding
The
feeling.
action.
Yeah, the action.
The thrill, the adrenaline rush that what comes with it. Like we've also often, and I believe you had this as well, like in your overseas experience, that you've encountered a really interesting and mysterious disease that you don't know what's gonna happen, and you're like so into it, and you're just like, oh, I want to know what's gonna happen to this
Yeah,
patient. Is
yeah.
this is the patient gonna survive, or what's the prognosis, or things like that. So those kind of things are really making it interesting, isn't it?
Yeah, but at the moment, I think what I'm lacking is like the knowledge about wounds. That's something I'm really keen and passionate about at the moment, and looking forward to be doing.
Oh,
Like, because
good.
when I started here, and then I've encountered different kind of wounds. Like, I don't know what stage of the wound healing process this is. Like I can't. I'm in the stage where I just wanna know, like at first glance, as to which stage of the
Yep.
wound healing thing you're undergoing at the moment. I wanna,
Yeah.
learn that field of nursing.
True. And like one good thing about nursing, guys, is that it like it gives you a lot of variety of specialties. Like me, I'm in emergency department. Ruel is in corrections. I also work in dialysis. There's also theater nursing. There's also medical surgical nursing or ward nursing, bedside
Mental health.
nursing, mental health nursing, community nursing, aged care. What else? I think there's a lot of things. Like even that wound nursing. I think vascular nurse, that's what they call it.
Tissue viability.
Tissue viability nurse. Yeah.
Because when I started, I felt so incompetent. Like the only wound dressing method that I would know is like basic cleaning with saline and then
Yeah.
put an island dressing in. But
Yep.
like I wouldn't know when to put some extra bits in there.
Exactly. Me
Yeah.
too. And I'm still learning about that. Like there's also not a lot of that in ED. Like since it's like a transient kind of department, they just patient come and go, and once we get to transfer into the wards, that's when the wound get looked up, and then I think that's more
Like it's not for everyone. 'Cause
True.
I don't easily get grossed out with the smell and the way it looks.
Yeah.
But yeah, it's definitely not for everyone.
Yeah, but it's something that you're very interested in.
I don't know why, but probably because I grew up with a grandmother that is diabetic, who had like some
Like
podiatry issue, like gangrenous wounds on her toes or foot.
Okay.
Like probably that at the background of it is making me curious as to how to actually manage it
Oh, nice.
properly.
Okay. Yeah, and it's a really good career as well because there's not a lot of tissue viability nurse.
But just thinking about it makes me recall about those gangrenous smell in my head at the moment. It's
Like-
really weird. Like
I know, right? Just imagining
Yeah,
it. Do you
imagine
have
it.
that, guys? Like even if you talk about food, like food makes you remember. Like talking about it makes you remember how it smelled, how it
again,
made you
the human
feel.
body.
Exactly. Very interesting. Very interesting creation of God, isn't it? So so far.
So again, what's your favorite, or is there something you're looking forward to doing?
Oh well, that's what I'm saying. I'm really happy in ED at the moment. like in future, I would think I'm that type of person as well that really is keen to, like, I don't want to be caged. I want to explore a lot of nursing specialties if given a chance. And yeah, I just want to be a very versatile nurse. Like if you put me in here, like I can function. If you put me in ICU, that's fine. It's all good. If you put me in the wards, then it's okay. If you put me in dialysis, I've got knowledge in dialysis. I've got knowledge in AD. So like I want to be that. Does that make sense? So maybe I'm hoping to level up in my career in the future, but like I also want to explore a couple of other specialties, not just ED. Could be ED, but could be different thing as well, a different section of ED.
Okay.
Yeah. Right? Wala ka agree. All right. So what's the best compliment that you've heard?
Oh, tough one. Well, because at the moment, since I work in corrections, we don't get that a lot.
Yeah, true.
Yeah.
It's a bit difficult. Like
Our bread and butter is copying abuse, actually.
but
It's like it's so common that like we don't get affected by it anymore.
yeah.
Yeah.
But in your experience, like generally, like when you started nursing, even when you were still a student, what was the like what really took you to like an emotional state when someone or like a patient said something to you?
Well, probably when they were like just emotionally saying thank you because we revived their loved one when I was in ED back then and overseas.
Yeah.
Like they were hugging, like not just me, like
The whole team.
the whole team that was trying to resuscitate that family member.
Yeah.
And then when that patient settled,
Yep.
like they were hugging us, and that gave me like a weird
Yeah.
feeling. It's like what's this? Like oh yeah.
Well, that's called emotions.
Yeah, I know. Like, but I mean, I didn't know how to react to it.
Exactly. Yeah, because you were not put in. You're just put in that situation, and you're doing your job. But in the midst of it, there's this people who's actually very grateful to what you did,
Well,
because it resulted to something that's positive.
probably because we're so used to moving on to the next job.
Exactly.
Yeah, I was like, I don't have time for this. I need to go back because I actually
yeah.
need to probably resuscitate another person.
Yeah,
But yeah,
true,
yeah.
true. Hi, Bobby. You want to say hi to the fans? Hey, fans. All right, like for me, the best is I think every compliment is the best. I mean, I can always remember the thank yous, and I think that's enough. Like, a thank you is enough. But if they put a chocolate or if they send flowers or chocolates or any goodies in the department, we would greatly appreciate it because, like we're also doing a hard job. It's not for everyone. I always say this to some people who's asking me like, hey, like you guys are amazing. The nurses and the doctors are very amazing. I was like, I always answer back like it's not for everyone because not everyone can tolerate needles, can tolerate blood, like in the sight of blood. Some people I have
Yeah, they
witnessed.
faint.
Oh my god, they just had like the worst faint that they turned white and like their blood pressure dropped and they nearly collapsed on me. I'm like, no, please don't do that.
Yeah.
So it's amazing. It's an amazing job.
It's so normal for us to go through those things that we don't even realize that there are people who are actually quite faint about these things, literally.
Yeah, true,
Yeah.
true.
Like sometimes I would say like, oh, that's just a very small needle. Why would you react to it like such?
Yeah,
But then yeah.
Apparently there's someone, and even just knowing that the needle is there. So I
Yeah,
had this really
yeah.
odd experience, like recently. It was just a recent experience that this lady came in, and the doctor wanted to do blood test. It's not even in the cube foss. It's like here. So I did put a 20 gauge in. It was well and truly in. But then she fainted. Oh my God. Her blood pressure dropped to 80s. And I'm like, wait, can you lay down? And I'm like, I can't lay down. I'm so anxious. Can you take it out? Can you take... Look, I can't take it against her because that's her reaction to what is foreign to her body. And that anxiety level and that's knowing that there's something like out that it's in is like making her anxious even more. So I'm like, okay, let's take it out. I'll talk to your doctor because it's not nice. Like again, it's not for everyone.
One of the wonders of the human body that I want to
Exactly.
learn. It all goes back to anatomy and physiology.
Yeah, true.
Like-
Very, very interesting bit. Hey, so what do you think are the best qualities of being a nurse? Like for you?
Like I'm not even gonna like this is not negative, but when you're a nurse, you get to be very tolerant of bullshit. It's not it's not a bad trade. It's actually a good one because it keeps you composed even through the most difficult situations.
Yep.
But yeah, that's probably one trait that isn't quite like evident to other profession.
I would agree to that because like I think nurses and doctors are very good at this. How can you put up a straight face for someone who's crying in front of you and someone who's also like yelling at you and giving you like verbal abuse, like it's quite hard. Like I find that we tend to develop this skill of or of numbing our face or numbing our emotions and just like crippling it. I mean, trying to put it down to its smallest kind of emotion and then just hide it in your pocket and just like, no, I'm not gonna react. Like even when the most funniest presentations come in, like,
true.
The one that, look guys, we put in a straight face that we try not to laugh professionally because we're
judgmental.
Exactly, and we try not to be judgmental because we're professionals.
Yeah.
But then at the back of our minds, I'm like, what the hell? Why did you like do that? Like it's.
But I guess it's also present for other profession, like
That's true.
Hospitality and
also police officers.
Yeah.
Security. But then again, it's also that because for me, like some people are like in a vulnerable moment.
Yeah.
Right.
Which we take into consideration.
Exactly.
Like, if not the top of the priority whenever you're dealing with someone.
Or another example would be nako is that like what if your patient who's been diagnosed with cancer was just so the doctor just broken the news like, hey, you've got cancer, you've got like say 4 months to live, and then you've got this patient who's had a baby the next like on the next bed.
Yeah,
like you tend to be empathetic and sympathetic on that someone who's been sad and like diagnosed with cancer, and then you tend to be happy for this couple who had a baby.
Yeah.
So your emotion is like
you have to switch to different characters.
Yeah, that's exactly it. That's a term that I'm like looking for. Like you've got to switch on and off.
Yeah.
Because you have to be
without having diagnosed of dissociative personality disorder.
Exactly, and bipolar. Like, is she okay? like
she was just crying with me a minute ago, and then
she's laughing,
celebrating in the next bed.
Exactly. So I think that's what makes us also like human and at the same time superhuman, because not everyone can do that. Like, yeah,
Very true.
Yeah, and I think this is just a couple that we're discussing, guys. But to be honest, there's a lot of best qualities for of nurses that we know of. We're not gonna point out every one of them, but I think being just flexible and being just resilient is, I think, the most for me is one of our best quality, and also like being able to just work and try not to think of sometimes we forget about ourselves. Sometimes. Yeah, like most of the time then, because sometimes we forget to pee. Like we're just so task oriented, like
True.
we just want to get the work done, and then we forget to eat, we forget to pee.
No, there's no way I will forget to eat.
I know. Sometimes in a busy environment like ours, it's so hard to take that meal break that you're you're given, but sometimes it's also like you have to be assertive, like, hey, I need to have a break.
I'm just curious about that though. Do you guys get paid for your meal breaks if you get interrupted on your meal break?
No.
No, okay.
So that's why like some of our CMs would actually encourage us, like, you really need to have a meal break. And there's like surge nurses, there's also extra hands around that you can just like, hey, I need a 20-minute break.
Okay.
I just need a 20-minute or a pee break or something.
I think that's what's good in our current like workplace,
Yeah,
because
yeah.
we're getting paid for meal breaks as well.
Exactly.
So, but then it comes with a catch that in case something happens on your meal
You're
break,
like on call.
yeah, you'll have to
Yeah, you have to
respond to
attend.
it.
Yeah.
Attend to it straight away.
Yeah. Ours is like, you deserve that 30-minute. That's it. Even if they page you, I'm like, nope, I'm not gonna fucking sorry. I'm not gonna do anything because I'm on my meal break. So yeah, I just need to have a rest. That's it. So anyway, okay. Like, and this is the opposite of the best qualities of being a nurse. Not really like worse, but I think my question is that what scares you about nursing? We can't really avoid the things that like really, this is a profession that has a lot of challenges. But what scares you while you're working as a nurse?
Just dealing with human lives in general.
Yeah, true.
The implications and the complications of the actions that you're doing or not doing. It's just scary if you really think about it.
That's true. For me, like, I think, I'm not sure if this is a term as well, but I would say the legalities of it. Is that it?
Yeah.
Yeah, because like your actions can affect a patient's life, and if you've given a wrong medication.
Yeah. Especially in this day of age where people would just sue people for everything.
Exactly.
Yeah.
True. And it's a bit scary because like in a matter of fact discussion, you're only just doing your job. Sometimes you don't get to, like, in your busy time. I'm not saying that this is an excuse, guys, but sometimes in your busy time, you don't have the chance to actually think. Like, sometimes you forget to think. You miss something, and then you just follow doctor's orders or what the doctor has wanted, but then you wouldn't had a chance to actually take a moment to just reflect on, hey, is this a correct medication
to
for
rationalize if this is the right thing?
I don't think it happens a lot in our department, because I would say that you've got a basic idea of how to treat that what do you call this? What to treat that certain disease, but then it also boils down to you being a bit your critical thinking, isn't it? Like,
and you can't use that as a defense whenever, like, in case there's a coroner's case to what happened.
Yeah,
like,
true.
Well, that's the doctor's order, but then you didn't use your rational thinking.
Yeah, and I think
that was right or not.
True. And it's the good thing about this is that we live in we're in a country where we can actually ask or question the treatment or the doctors for what they're doing, because, like, say, because you have the right to actually be the voice for your patients, because they don't know, sometimes they don't know what's happening, and then they just end up like having 2 doses of this, and then what for?
Yeah.
You get what I mean? Like, we're so lucky that we're in this country. All right. So I think, in general speaking, guys, the legalities of being a nurse, and it's a really, the bearing of it, the responsibility of being a nurse is so intense. And the fact that we're still scared of that means we're also great nurses, because we still think of our actions before we do it.
Always be mindful.
And I think that's it. If
you don't have to be the smartest.
Exactly.
Or you don't have to know it all. You just have to be mindful.
Exactly. And like, if you're overconfident, I think you should really reflect. Really reflect on yourself, because if nursing doesn't scare you anymore, oh my God, that's a bit problematic. Because at the end of the day, you're gonna be Like, you know, you don't want to be in trouble. That's what I'm saying. Anyway, because that's like your future that's going to be at risk as well.
Yeah, your
Your
license is
livelihood,
gonna be
your license, your livelihood, everything that comes with the perks of being a nurse. So we're going to talk about that, I think, in a later episode. But I think we should, wrap this up. All right.
You want to end it lightly?
Yeah. 2 more positive questions.
Oh, okay.
All right. Question: are you proud to be a nurse?
Oh, definitely. 100%. Like I don't mean to brag, but
Yeah.
I haven't won an award every International Nurses Week, but I always get nominated for something.
That's good.
Have you seen my
I know.
laminated certificate?
I know.
Every single year.
That's why I'm so proud of you, because like you're making a difference and you're doing a great job at your workplace.
Yeah, like you don't have to win anything to.
Yeah, exactly.
Like just getting acknowledged and by your colleagues.
Yeah,
is a big thing.
Like for me, I don't have awards, but then just saying like you're a really good nurse, you know that.
Yeah.
Like
if not for the demographics I'm working with, I would be proud of wearing my uniform anywhere or like wherever I go.
Yeah,
it's just that it's easily recognizable that the demographics I'm working could easily recognize me, and I don't want to get like
it comes with consequences. Right.
Yeah.
Like true. But like to me, to be honest, it's like because I'm not complimenting myself. Like sometimes I'm hard on myself.
Oh,
which is about like the most ridiculous thing, but I'm hard on myself. But then when people tell me like, hey, you're really great, you're an amazing nurse, hey, you're a part of a team now, like even like the time that I told you that I was part of Resource, like even when I wasn't I wasn't supposed to be part of Resource, but then I helped out. They really appreciate my input and the fact that I was there willing to help, lending a hand. It was, for me, it was a pleasure. It was like a really
good on you.
Yeah. My heart is so full because I'm like, no, you're part of the team now. I'm like, okay, thank you for the recognition. Not every day that I get to have that. So anyway, okay, last na lang. Being a nurse, is it rewarding?
Well, doesn't that relate to the first question?
I think so. Yeah, I think so.
That's rewarding. It pays us big bucks somewhat. So quite literally, it's rewarding.
Yeah, and working here, it's very like we're well compensated, I would say. Yeah.
Apart from all those stuffs that we previously mentioned, it is definitely rewarding.
Yep. And being a nurse here, being a nurse in Australia, to be exact, gave us a lot of opportunities. It opened a lot of doors. Gave us the house, the cars,
the three chunkies.
The 3 chunkies.
Most importantly.
True. And it gave us just the opportunity to live a comfortable life. Yeah.
I wouldn't say comfortable.
Well, we're still comfortable. I think so. We're still blessed and comfortable.
We're blessed.
All right. Okay. All right, guys. So before we end this, I would like to give a shout out to new nurses,
or to all the aspiring nurses.
To all aspiring nurses, and also to those who are very interested to be a nurse. Please do. I hope you look at like videos like a day in the life of a nurse. It is interesting. It is challenging. It is great. But at the same time, it has a lot of responsibilities.
Yeah.
But then again, I know if you're looking for a really rewarding career, nursing is definitely one of the best choices. I would say like 100%. Yeah. So
again, guys, if you think studying nursing is hard,
try to be a nurse.
Try to be an actual nurse.
Yeah, true.
Although the difference probably is like you get compensated for doing it.
Yeah, true. Yeah. And like,
but
take it from us, because
pursue it if you really want to.
Yeah, true. And we're inviting everyone, if you guys have the heart to work in healthcare and, like helping people that are in dire need of assistance, and of course those for vulnerable ones. I mean, like, look, I think this is the way and a profession for you. So
keep pushing.
Keep going, and then just don't forget, feel free to ask us any questions if you need some guidance or any advice if you're pursuing nursing. Okay, yes, that wraps up our night. You happy?
Yeah.
All right, I think you should click that button, and then
sorry.
Oh my god, sorry guys, my husband is like,
I had a brain fart. my thoughts and prayers to all those people who are studying nursing at the moment.
All right, guys. So
just kidding.
We are really so happy to celebrate Nurses Week this week. So happy International Nurses
Happy
again.
International Nurses Week.
Hope you guys have a good one. Take it easy, look after yourself, and enjoy all the chocolates and the lollies that are given to you by patients. Celebrate nurses every day as well, and be grateful. I'm Sheila.
And I'm Ruel.
And this is the
CommoNurse Podcast. Till the next one. Bye.